stigma, belief, cultural beliefs, all those family stigma, everything kind of limits them wanting to go and access these services.
Welcome to another podcast with IBIC with Karen. We've got an exciting podcast lined up for you today. We're joined today by Dr. Kevbe, and we'd like to welcome you, Dr. Kevbe, to IBIC with Karen. How are you doing today?
Yeah, I'm doing well, fine, thank you. Very well.
So it's really lovely to have you on the show today. We had such a great conversation about your topic for today, and I'm sure our viewers will be really intrigued to hear about that. But before we come to that, just want to give you some introduction about your background. Currently, I know that you are lecturing, and you also did your applied social sciences, so a doctor in applied social sciences in psychology. And your research focus was on mental health and service engagement. So in particularly, you were looking at correctional officers and the marginalized settings in which they were working. So let's start with your research. So tell me a little bit about your research and how that came to fruition. Why that topic?
Okay, so prior to coming to the UK, I worked in an NGO, and I had opportunity to work with different vulnerable groups, and one of them was like the inmates, the prison community. So I've seen that they have a lot of inequality when it comes to accessing health services. So when I did my masters in Robert Gordon University in Aberdeen, there was a particular topic we did on population health, and that kind of aroused my interest in doing a research on that population health and with emphasis on the prison. So I also have interest when it comes to mental health issues as well. So I felt, oh, why don't I do a research about mental health issues within the prison community? Then I did a background research online and discovered that there's very, very little research that has been done around this area among the prison community, most especially in Africa and even in Nigeria. So that was what kind of aroused my interest. And secondly, my mom was worked in the prison community. She was a prison officer for over 30 years, 35 years of her life. So that also kind of aroused my interest in going into that research area.
Brilliant. Thank you so much. And I really resonate with the work that you've done because I'm also fascinated with the work in prisons. I volunteer as a chaplain in prisons, and we work with the inmates. So talk to me a little bit about the marginalized settings. Why was it so marginalized?
I think it's because there's very little support available for the prison community in general, even when it comes to health services, not even to talk of the mental health services. For instance, in Nigeria, if there's an annual budget, you have like just 5% allocated for health services in general, and mental health service just get less than 1%. And sometimes, not even talking of the prison community, they don't have little, like in terms of even staff availability, there's not enough well-trained staff, healthcare professionals to even support these inmates. Like in Lagos State, for instance, we have only one psychiatric doctor that caters for over thousands of inmates. So you can imagine how that is. So that is a very large gap in that area. So that is why I said there's a lot of inequalities when it comes to accessing even just health, not to talk of the mental health services.
Yeah, and thank you. One psychiatric doctor. I can't imagine the challenge in that space. I mean, here in the UK, we have so many
Yeah.
psychiatrists, but they're just not enough of them, unfortunately. But to just have one, yeah,
Mhm.
that's a big task. So what do you think the government's doing then to improve?
Um,
Um,
I think for now, there's been like a lot of advocacy. There was a recent mental health policy that was established in 2023 in Nigeria, like trying to support like in terms of accessing services, improving, and also um adding it to the primary health setting so you don't have to go to tertiary institution. So but that's what the policies those were some of the policies that were trying to kind of bridge the gap between poor access and availability of these services in Nigeria.
all right, thank you. Um, And I know that when we had a previous conversation, we touched a little on mental health stigma within various different communities. But I know that in maybe some parts of Africa, it's one of those taboo subjects that no one seems to talk about. Can you shed a little bit of light around that? I know here in the UK, in some of the more ethnic minority communities, mental health is still a stigma. And even though lots of work have been done around engagement and trying to engage the communities, it's been quite difficult. But I think that's changing a little bit due to social media and um, all the publicity in those spaces, should I say. So I think it's changing a little, but there's still a long way to go. So talk to me about what is it like in Nigeria? How does it compare?
Yeah, I think when it comes to mental health stigma, and even from my research, one of the reasons why there's a lot of stigma around mental health issues, number one, there's poor sensitization about mental health issues. In
Mm,
Nigeria, they just feel okay if you when they call names like mad people, those kind of derogatory names to people that have mental health issues. There's also the issue around the cause, what causes mental health issue. That's the etiology. So there's
mm,
always affiliation with maybe punishment or voodoo, demonic possession, witchcraft, and all that. Those kind of perception kind of creates this stigma for people who have mental health issues. Sometimes they feel, oh, maybe you've gone to do a ritual or you've done something wrong. The gods are punishing you. That's why you have. That's why the person is mentally unstable. They also talk about maybe the person has gone to engage with taking drugs and the rest. So that could also those kind of negative labeling. That's why there's a lot of mental health stigma in Nigeria. And like I said, for me, I think more is the lack of sensitization. So because of that, you even have individuals who have mental health issues like maybe depressed, anxiety and things, depression, anxiety and things like that. They don't want to come out, they don't want to seek help because of the stigma that they would face if they come out to seek help. And some of them might look at it and feel like, oh, if I go out, they'll say, oh, it might be like a stain on my family, like family disgrace and all that. So because of all these things, sometimes it limits individuals to kind of go and seek help, even especially when it's at the low neurotic stage. So most times you find that individuals go to seek help when they've gotten to the psychotic stage, when it becomes like a crisis level. So it kind of delays early intervention for these individuals as well. So that's one of the things about mental health stigma. And even for my research, initially because of going into the prison, when I did my research, I had the mindset of, oh, when I go to the inmates and I speak to them, they'll just be like, oh, maybe they have poor access to, there's not enough good facility available for them. That's one of the reasons, because my research was looking at what are the barriers, the facilitators that encourage influencing them to engage with these services. So my mind was looking at, oh, if I go, I'm sure they would, but that was my own assumption. I'm sure they will be like, oh, it's because of the services are no good. To my own surprise, I go into this and they're talking about demonic possession, spiritual attack, things like that. That's what they believed was their mental health was what caused their mental health issues. And some of them were saying they don't even want to use, they don't believe in this medication they are taking. They'll rather go and see a pastor or they'll go and see a priest or a voodoo priestess or something like that because they believe they will be healed if they go see those people that are taking medication. So this also goes back to the cultural and traditional beliefs about what really causes mental health issues.
I think you raised some really good points there, especially around those cultural values that we hold so dear. And think, but you would almost assume that in 2026, with all the education that's taken place around mental health in various different countries, different platforms, who even various mental health institutions, that some of that stigma would have lessened by now, but it seems as though that's not the case. And but yeah, I think culturally, it's hard to break those cultural norms. Um, but I guess we just continue to push forward as best we can, and
Yeah,
I'm sure there are others who are actually working to make that happen as well. Sorry,
yeah,
you were there. say?
Yeah, I think it's actually better now. People are more getting more sensitized about mental health. Even
Mm.
people talk about men's mental health because like things about this toxic masculinity, which is like some traditional beliefs that people hold and men hold and saying, oh, it marks your vulnerability, all that can limit wanting to seek help. But now there's a lot of sensitization around men's mental health, even in Nigeria, for instance. So it's sensitization is getting better. People are more becoming more aware about mental health issues. So unlike years ago, but despite that, the still old traditional beliefs, cultural beliefs are still there. Like one thing that kind of surprised me for my research was when I worked with the correctional officers, the mental health, or one of the correctional officers, which is a mental health nurse. I was surprised for her holding such beliefs as well because she has been practicing for over 30 years. She believes mental health issues is caused by voodoo, demons, witchcraft. I was kind of surprised and I put it in my reflection. I was like, this is a mental health nurse for practicing for 30 years and she still holds this strong religious and cultural belief. So you say that it's still something that is still deeply ingrained into the system, into the cultural fabric of us. So even though you might be exposed, you might be a mental health professional, you might still hold certain beliefs about mental health issues.
Yeah, so true. Thank you for sharing that. Were there any other surprises that came out of your research?
Yeah, I think for my research, one of the, like I mentioned the surprises because I did not envisage the role of spiritual attack, the role of
Mm.
spirituality, spiritual influence. My mindset was talking about, okay, probably they will say bad infrastructure. So going and practically 80% of the participants are talking about spiritual attack. They are used voodoo, things like that. So it was kind of surprising to me as a person because I didn't expect that. I expected something else. And also, I just mentioned the other one that surprised me was even a mental health officer, a mental health nurse that's been practicing for 30 years still holds these beliefs of voodoo.
Mm.
And so it was kind of surprising as well. But it kind of took me back to when I was practicing back home, when I was working in an NGO, and we worked with these people, we call them traditional birth attendants. So you have people that don't want to go to the traditional hospital, the mainstream hospital. They want to give birth traditionally. They meet all these traditional healers and traditional practitioners to help give birth. And I was surprised that there are even some of the traditional birth attendants spoke about some of their clients being healthcare professionals coming because it's like a tradition thing. So it kind of went back to how the role of tradition can play a very strong role in
Mm.
setting views and beliefs despite even being exposed to Western education.
Yeah, thank you so much. Um, so what do you think are some of the social consequences then faced by people with mental health conditions?
I think we've talked about stigma. We've mentioned the role of mental health stigma. They are stigmatized. There's also sometimes they can experience social exclusion. Even sometimes family can feel like, oh, isolate them, you're cursed or something. You're not normal. They've cursed you, things like that. And it all links back to what causes mental health issues. Their belief of saying it is witchcraft is because they've done something wrong. That's why they have mental health issues. So it all links back. Some of them even suffer from even getting employment. They might even also not even get housing and things like that because of that stigma. So it's kind of like a vicious circle around them, those individuals, and that is some of the consequences they might face.
Consequences. Yeah. So any ideas then in terms of those who are probably marginalized, I guess, um, and perhaps left to fend for themselves, maybe thrown out on the street. So are there volunteer services or who would like support in that regard, or are they just on the streets? What have been your experiences around that?
So I have not because my own research was focused on the inmates who were in
Mm.
the prison, so I didn't really look at general population. But based on my own understanding around and the little knowledge I have, I know there are NGOs that kind of offer support to such individuals. They also have all these faith-based um, locations where they take them, they go to pray for them. But unfortunately, these people are dehumanized. Some of them are beaten. They try to say they are beating out the demons. They experience physical abuse and the rest. So aside that, I know there are NGOs that kind of offer support. They have few rehabilitation centers You have the psychiatric hospital in Lagos State, which is one of the biggest in Nigeria, where they also some angels, individuals might support people to access these services. So I think that's the little I know when it comes to within the general population.
Mm. It's so interesting just to hear a different perspective because I know, so like in the UK, it's mental health is a big topic, and you've even touched on one of those topics around men's mental health, which I'm sure isn't just unique to the UK in terms of the challenges in those spaces, but it's a worldwide challenge, isn't it, for men? And a lot of work has gone into setting up lots of groups and working with different community organisations to support men in that sphere. I know that in some prisons, they do have a mental health ward, and so they would actually look after the prisoners in those wards. They take them to hospitals if they need to, and try and sort of like rehabilitate them and to take them back into society. So there's lots of work that goes on, and you know, just condone those who are working out in the field in mental health across the world. It is, it's one of those fields that can be very, very challenging for individuals. Recently, we did some voluntary work. Well, I do voluntary work in prisons, and one of the young men came to us, and he said he was diagnosed with schizophrenia, and unfortunately, when we went back to visit, he was taken to a mental health hospital because he wasn't very well. So it's nice to see that the support is there as well
Yeah.
for those individuals who really need it. So in terms of I know we touched on the spiritual or traditional beliefs around mental health, so we probably won't maybe touch on that again. And now, in terms of thinking around the ethnic rights, we talked a little bit around the barriers as well. So those barriers that are faced. But in terms of like cultural identity and influence based on mental health, how do you feel that probably links to the wider sort of like African diaspora and communities, probably in different locations? So, say for example, individuals who may have left Nigeria, may have travelled or lives in other location in the different parts of the world. How do you feel that influence of probably cultural shift has probably impacted in terms of how they view mental health?
Yeah. So the good thing about in the maybe Africans like immigrants in that are in diaspora is that they have better, even though they still hold certain beliefs about this spiritual influence and the rest of it, there's still this um, receptiveness towards biomedical approach because they are more sensitized, they are more aware about mental health issues. Like I said, like for me, I said the number one issue back home is poor sensitization because there's a lot of wrong perception about misconception about mental health issues and the rest of it. Like you can't if somebody says, "Oh, I have a mental health issues," and you're normal, they feel, "Oh, it's only people that have psychosis. It's only those with psychosis they kind of say, yes, those ones are the mental health issues." But actually, you might be a working individual that is depressed or has anxiety. So we don't see that back home. But now there's a lot of sensitization. So because of the poor sensitization, that's why they have this wrong misconception about mental health issues. But however, Africans here, even though there are certain barriers and they still hold certain views, because of sensitization, because of awareness, I think they would be more receptive towards westernized approaches.
Brilliant. Thank you. And yeah, and I would agree entirely with that. I know you touched earlier on about the government funding is, it's not a lot. So what do you think the solution to that funding challenge might be? Whether it's external support, maybe from the WHO organization, for example, or another organization that supports. I don't know, what are your thoughts, or what have you seen in action so far?
Okay, like for let me use the case study of my research that's within the prison community. So when I interviewed the inmates as well as the prison correctional officers, they spoke about that the government doesn't give them enough support. However, they have NGOs that kind of support them. They kind of help them in terms of providing medications that they need for the inmates and things like that. Sometimes churches help, mocks help as well. So they kind of bridge that gap. But generally, the government alone is not sufficient to supply them all the necessary resources that they need. So this is just like is a national issue that even healthcare is also suffering in Nigeria. Like just 5% of the annual budget is allocated for healthcare, not to talk of mental health services within it. So that's a major issue, and that is why you have individuals, even private individuals, NGOs, and churches and the rest try to kind of bridge that gap and support mental health services in the prison facility, in the prison community. And I believe such individuals and such organizations also do the same within the general population as well.
Ah, brilliant. Thank you. So maybe just talking a little bit now more generally about mental health and some of the coping strategies or coping mechanisms. I know in your research, not sure if you've picked up anything around that in terms of generally around how people tend to cope.
So usually the first point of contact for most of the time is usually informal support, maybe through family, through churches. We don't like Africans are very religious people, so they always say, okay, we'll go to God, we pray, God will help us and things like that. So they go to church, they go to the ones that are the Muslims, they'll go to the mosque, and that's usually their first point of contact. For those that kind of are traditionalists, they will go and see a chief priest or a priestess to come and like tell them to use soap. Like you see some of my inmates that I interviewed talked about how they went to see a priest and he gave them a soap to bath. That soap helped to cure their mental health issues. So usually the first point is usually going to see these individuals. They get support from religious activities, religious affiliations. So that's how usually they get support back home.
Okay. And obviously there's the other route around medication, for
Yeah.
those who really want to go for that. Was there anything from your research that you felt that would be really interesting to share with our viewers?
In which of them, which aspects? Because there are a lot of aspects of my research.
So maybe something we've not touched on already, that you feel that would be important to disclose in terms of your research. Maybe some of the maybe recommendations that you came out of your research towards the
Okay.
government in terms of changing policies, perhaps, or informing change. Yeah.
Yeah, I think some of the policies I kind of recommended was training for healthcare staff because we found out that one of the participants I interviewed, the psychiatric doctor, she mentioned the fact that some of them are not, they still have stigma towards individuals in mental health. They feel they are dangerous and they tell them to go away and things. And these are people that are supposed to support these individuals. So I think more training, like before they go, prison officers should have like at least the first line of training on mental health, understanding the symptoms. They don't need at least the basic training. They need to have that. That was one of my recommendations. Then I also talked about infusing culture into Western approach. I think even the NHS has started doing something like that for Africans and other cultures in, to kind of integrate culture into the approaches they give as well when it comes to mental health services. So I talked about and then even research, I saw research talking about how they can use can do something like spiritual counseling. So you have like a pastor that would also counsel and things like that, so they can feel like oh, they can have like feel their culture and things like that and their traditional beliefs. Then I also talked about training traditional and faith healers because that could also help to bridge the gap because we know like in Nigeria, for instance, you don't have enough psychiatric doctors. You have about 150 for the whole over 220 million individuals in Nigeria. So that's very small. And you don't even have enough psychiatric. I talked about only one psychiatric doctor in charge of how many states in one state. So some states don't even have a psychiatric doctor in the correctional officers in the correctional facility. So that's why I would say they can kind of integrate, collaborate with traditional healers, faith healers, train them on mental health issues, and also bring them into supporting as well. And I mentioned about supporting from NGO, subsidizing, because one of the all thing that came out again is that the medication is quite expensive, and they had to. That's one of the reasons that maybe it's not the government is not able to keep up with the finances, and they have to keep depending on NGOs. So I feel like there should be like a policy that kind of subsidize this medication so that at least it's more affordable for the government. Maybe the government should put a policy for the manufacturers that bring in these medications, things like that. So these are some of the policies that I kind of recommended for in my research.
Ah, that's brilliant. Thank you so much. And in terms of just generally talking around mental health, and I hope that those policies or recommendations were actually addressed and taken on board. I really do hope that you were able to inform change in those areas. Um, but just going back to maybe generally looking at what are some of the signs and symptoms really. So if someone's come across our podcast and thinking, well, I'm not quite sure what to look for in the signs. How can I support maybe a family member and to identify what's considered to be how would you how could they support their family members?
Okay, like how can they be able to identify like the signs if they see
Mm.
maybe if any of the family member is experiencing a mental health issue? Is that what you're asking?
Yeah, yeah, yeah.
Okay, like for my participants, most of them talked about hearing voices. They talked about isolating themselves, being very depressed, having suicidal thoughts, and hearing voices. Especially that was like most of my were recovering schizophrenic because most of them talked about hearing voices, voices telling them to do what they don't are not supposed to do, not willing to associate, isolating themselves, not having appetite, not eating, losing weight, and I think those were some of the signs they talked about that they experienced. And even one of the participants talked about that was even one of his colleagues saw him, one of his fellow inmates saw him that way and had to report him to the correctional officer. That was how he was linked to mental health services because he noticed he was very withdrawn, he wasn't eating, he started losing weight, and that was the signs they saw. So maybe these are some of the signs they can look at, like sudden change in behavior, like somebody that is very happy, jovial, suddenly just withdraws, just isolate themselves, not because anything particularly happened, they just suddenly don't want to do the things they enjoy doing anymore as they used to do. So those are the kind of signs that I think they can look out for.
Absolutely. Um, and yeah, I think you are correct in terms of even those behavioral changes, isn't it?
Yeah.
The viewers may notice that family members or friends are not how they used to be. They've lost the enthusiasm for life, which is probably bordering on maybe a little bit of depression. Sometimes people say, well, snap out of it, but sometimes it's harder for individuals to move past the stage that they're actually at. And that support is needed more than just, let's just pray about it or, let's just be strong, we are strong people, let's be strong. And sometimes it warrants a lot more than that. It warrants intervention,
Okay.
especially like you said, I think you alluded to earlier about those early intervention stages. Um, did they talk about what factors may have led to their breakdown? Do you think maybe it could be something, I don't know, financial or family challenges, or were any of those discussed?
So I think it was just one of them that mentioned that probably he was taking drugs. He was taking crystal meth. That could have been what triggered his. Every other one was more of they believed it was spiritual attack. They were okay. Then one person said he believed his mother did something to him and things like that. So aside that one individual that believed it was Okay, there were two actually. One believed it was drugs. The other one believed because of the being inside the correctional office, being inside the prison, because he believed he was being charged for, he was wrongly accused of a crime he didn't commit. So he felt that kind of affected his mental health
Yeah,
issue.
sure, sure.
It affected him to develop mental health issues. So those were the two. The rest believed it was spiritual attack. That was what caused their mental health
Mm,
issue.
okay. Um, yeah, so in terms of when we look at are there any sort of like comparisons with the UK and maybe comparisons with any of the African countries that you feel are just so different in terms of how things are dealt with?
I think
'Cause
when in comparison, like Asian and African countries, that is collectivist culture, they kind of align more towards this spirituality, spiritual attack, traditional beliefs, and the rest. However, for UK more aligned towards biomedical, and there's no, because like I said, there's more sensitization. People are more aware of what mental health issues is and things like that. So I think when it comes to affiliating and being more receptive and wanting to seek help, people within the UK, especially white people, not African immigrants now, they are more willing and desiring to actually go and seek help. And many research have seen that even white British people want to seek help more than their black counterparts, because these individuals are reluctant. We've talked about things like stigma, belief, cultural beliefs, all those family stigma, everything kind of limits them wanting to go and access these services.
Yeah,
So that's my own take on that.
brilliant. Okay. Um, well, thank you for your insight, for all the information from today's podcast. It's been very inspiring, very encouraging, and your research is, I'm sure it's not, you've got a lot more to do in terms of following up on those research. Is there anything you're currently doing in terms of advancing the research or enhancing the study you've done? Have you presented any papers around what you've done so
Yeah,
far?
I've done some. I before I that was last year. I did like presented in two conferences. But at the moment, I'm working on a manuscript to for publishing, and I'm also working on going for other conferences as well and doing presentations around it.
Ah, brilliant. So if anyone wanted to find out any more information about your work, where can they go? Where is it published?
Yeah, I remember I sent you the link, so you can easily see it. It's there. The dissertation is open science. I posted the the title, so which is people in prison and correctional officers' perspective on their lived experiences. By the time you type it on Google, you would see it.
Yeah, they come up, yeah.
Yeah, it's going to come
Oh,
up.
brilliant. Is there anything else that you'd like to leave with our viewers in terms of mental health and the stigma around that? Or do you think that we've pretty much covered everything today?
Yeah, I just think we just need to be more empathetic towards individuals, and we need to sensitize ourselves more about mental health issues. It's not just they are working individuals that may be suffering from mental. For the fact you see
Mm.
your fellow colleague at work doesn't mean they might not have a mental health issue. So we need to be more empathetic towards individuals in general. That's all I say, because we're all going through something.
And so true, isn't it? And sometimes you are correct. We see individuals who are suited and booted, and we just think,
Yeah,
oh, they're fine. They've got the 2.4 children, and they've got the big house, and they're doing just fine. But everyone at some point would have been impacted by mental health.
yeah,
It's interesting to see that some of the stats around, 1 in 4 will
mhm,
experience a mental health problem.
yeah,
That's 1 in 4, that's quite a lot. And I'm pretty sure it's probably even gone up even further than that. It's probably quite higher than that, actually. 1 in 5 adults experience a common mental health problem, such as anxiety and depression. So the challenges are real, and it's mental health doesn't only impact adults, it's also impacting young people, children. And when
yeah,
we look back even to COVID time and look how that has impacted a lot. So there is still a lot of work to do, I think, in mental health. I think we're only just scratching the surface in terms of the support that we can actually provide within communities. And, I do commend those in the community who are working tirelessly to ensure that they are advocating for mental health staff. But, there's still those levels of inequality. I think especially probably in the UK, where we talk about those postcode lottery. So if you're not in a certain area, then you don't get the
Yeah.
support, and it's a huge issue. I don't know if there's anything you want to say around that.
Yeah, definitely. So we talk about health inequalities, and we look at the link, and we talk about if you hear the social determinants of health, for instance, where you live, where you work, your
Mm,
community, all determines your health outcome, even the income you make. And we found out that there's a higher life expectancy for higher brow areas like people with higher socioeconomic status. So it's still linked to
mm,
mental health issues as well, and the inequality they are talking about around health in general.
absolutely. Absolutely. So I just want to say thank you again for joining, and to anyone who needs any support. I'll leave some support links in the chat, whether you're a young person, an adult, and I'll also liaise with Dr. Place the link to her research, and you can read a little bit more about the fascinating work